You're tuned in to Women in America, the podcast that dives deep into the issues shaping gender equality in the U.S. and beyond. Hosted by Pari and Eve, public health professionals by day, content creators by passion, we bring you expert insights, compelling stories, and actionable strategies to push the fight for equality forward. In our first few episodes, we're talking about rights at a crossroads, unpacking the intersections of reproductive rights and gender justice in today's America. Reproductive health decisions don't just affect personal lives. They ripple out into careers, into income, and workplace opportunities too. Today we're examining how abortion access or restrictions impact economic equality and workplace gender equity. So from paid leave policies to economic consequences of forced pregnancy, we'll talk about how to build equitable workplaces for all. Let's dive in.
You know what's crazy is that whenever people talk about the impact of pregnancy, the obvious thing that people think about is the physical impact, right? Which is huge, massive. Your body is never the same. Your brain is never the same. There's so much data on that, and we should get into that in a different episode. Mm-hmm. But what I want us to talk about today is how intensely a pregnant person's life shifts in every aspect as a result of pregnancy. I'm like 36 weeks pregnant right now. And I've just been thinking about how the last 8 months of my life versus the last 8 months of my husband's life have been so drastically different. Nothing in his life has shifted. Mm-hmm. The things that have shifted are like, okay, yeah, he has a to-do list that now involves like setting up a nursery. Yeah. Versus for me, not only am I dealing with the intense physical symptoms and changes, but I have made changes at work. I am about to exit the workplace for several months. Mm-hmm. I have been having to take time off to deal with the physical stuff that I'm experiencing. And also just I'm about to take a break from a career where I have spent 15 years trying to establish myself and reached a point of, I'm a subject matter expert now, but also now I'm about to dip. Yours and my social media journey, I've also been feeling like we are on the precipice of being able to launch into something bigger, while at the same time, I now have to take a step back. And so I would love for us to really get into today, like the impacts of reproductive health and pregnancy and gender equality, all in like the workplace, the things that people don't think of, basically.
That's really interesting because I think from thinking about your career trajectory or any woman's career trajectory to their income stability, the choices that we have or lack of choices, as the case may be in the US, about our reproductive lives impact way more than just what our plans are this weekend and how that will change when and if we have children. They shape our professional trajectories. You're not only exiting the workforce, but you are having to decide for yourself, are you going to re-enter the workforce afterwards? Yeah. Or are you going to stay at home? That is up to you. It also affects workplace dynamics. So when you or any pregnant person exits your team, other people have to shift around you to cover that load, as they should. And it even affects, honestly, the larger economy.
For sure.
And I think a lot of that is lost in pregnancy conversations that are mostly circling what the physical experience is like.
For sure. The irony of what I'm saying is that this is even only in a situation where someone even has the luxury of thinking about whether or not they want to return to their career, right? Like if everything has to go right physically, you have to be financially in a position to be able to afford it. Your partner has to be able to support you. The baby that is born during delivery has to be healthy. So there's just so much that has to go right for you to even be able to have those conversations. And I don't think a lot of people realize this, but the United States is the only country in the entire developed world that does not have mandated paid maternity leave, which the impact of that is truly insane. Because if you think about the reproductive health policies that are now the norm in this country, right? Like it's forced birther nation in most of the states. And yet there's no actual support for when you go give birth. So you're thinking about now a group of people who are not able to access paid maternity leave or family leave and are either having, like so many of our followers have shared in our DMs, having to go back to work like 3 days after they give birth,
Hmm.
or just like check themselves out of the workforce for the sake of their families or their own health.
I want to clarify, we should share some of those stories, but before we go on, I think we should clarify what we mean by no mandatory paid maternity leave because
Mhm.
people will come in and be like, well, my employer gave me 8 weeks, or the federal government gives 12 weeks now. First of
Yeah.
all, the federal government maternity leave, it's actually parental leave, which is great. That only happened last year in 2023. So, yeah, great. You're 40 years late on
And
that.
it's only if you're an employee of the federal government.
Only if you're an employee of the federal government. And then if you get paid maternity leave through private employers, it's because they chose to do so, not because they're mandated to do so. And so they could give you 3 days, they could give you 4 weeks, they could give you 8 weeks, they could give you a year. But like you're saying, Nordic countries, Finland, Sweden, they have like a year of
Yeah.
mandated maternity leave.
The discrepancy is really quite alarming.
Mhm.
And also for the companies that do offer it, there are certain states like California and Washington. They've passed state laws that are encouraging employers within their states to offer it. And California, for example, we all know is a tech hub.
Mhm.
And they are leading the nation in maternity leave because of the fact that tech is a competitive industry. So Google, Facebook, Uber, they're all sort of competing with each other to maintain employees, which is why they offer a certain amount of maternity leave within their policies because it's kind of standard practice within their industry and also it's mandated by their state. But then you
Mhm.
compare to the other end of the spectrum, like Alabama, Mississippi, where there is no mandate and so it's zero. And so, yeah, we've had some really unfortunate stories from the women who follow us. There was this one woman, and she's like a freaking superhero.
Mhm.
Her job also requires her it's a physical job, so she's standing, it's not a desk job. And she was telling us about how she went into labor on a Thursday, gave birth on Friday, and was expected to report and did back at work on Monday.
Mhm.
And first of all, that's insane. Like you have a dinner plate sized wound
Mhm.
on you and you're doing a physical job. But second, like there is full blown research to suggest that the health outcomes for newborns and infants who are not able to have dedicated time with their moms
Mhm.
is different than the health outcomes for babies that have access to their parents, right?
Mhm.
So it's weird. I mean, it's not weird, it's very intentional.
Mhm.
But like the US is basically creating an environment where they're like, okay, the sole purpose of women is to have babies, but we are
Mhm.
not going to support you in that process whatsoever. So you're
Mhm.
just going to have to act like a birthing machine. And in fact, we will punish you in every possible way, both physically, in your careers, in your income, in your capacity, in every way once you do this.
Well, I think part of the Republican strategy is dehumanizing women. I think part of that is normalizing the dangers of childbirth to a point where it's not a big deal anymore. That is part of patriarchal norms, right? And it's infiltrated our corporate structures, where the example of the woman who commented, and I remember that reply on our post, was back 3 days later. And all the women in the replies were like, can't believe you did that. Good on you, sis. Major props to her. But do you remember the men came in too and were like, see, she can do it. So why do we need to give more paid time off? Just because she can doesn't mean she should.
Yeah.
I took a week off when I had shoulder surgery. And that was totally appropriate socially. Everybody I spoke to was like, "Oh yeah, that's great. You should take off more time." But when you have a procedure or something that relates to your reproductive bits or your vagina, it's a whole different story.
I mean, men get prescribed 3 days of rest after a vasectomy.
Yeah.
And yet women are going back to work after giving birth sooner than that. Also, just want to point out the fact that I can even quote a statistic that says, hey, the United States is the only developed country in the world that does not have paid maternity leave means that paid maternity leave is a standardized development marker globally.
Yeah.
So it's not something that like Eve and I just came up with as like, oh, we think the US should be doing better on this. No, no, no. This shit is globally agreed upon a marker, a definitive, a determinant of how a country is treating its women. And we are failing so drastically on this. And yet men will still fight us, being like, why should I pay for
Yeah.
you to do this? And I'm like, this is like, you don't even understand the basics of what it takes to like to run a country. It's truly mind-boggling. So then obviously you would think that suggesting that paid maternity leave exists, if we think that's the baseline, then imagine us trying to fight people on things like insurance coverage
No.
or like breastfeeding coverage and things like that in workplaces and in all of these environments. And sometimes it's really just, wow, we are walking uphill and there's no end in sight. The
I
summit
mean,
is
I
not even
think
close.
it shows us that the end game is to keep women barefoot and in the kitchen. They should want us to return to work for the good of the US economy, but they don't want women to have that type of financial power and control. So if they don't let you heal properly, if they don't let you take the time you need, the less time you're going to be in the workforce overall, even if you go back right away.
Yeah. And we also see a lot of data, both systematic and anecdotal, on how women are like subconsciously or quietly punished, right, for the fact that they are off reproductive age. Or if an employer suspects that one of their female employees is going to get pregnant within the next year or two, that they're like denied opportunities or they're not able to get new jobs and things like that because there's this bias that exists where people are like, oh, well, a woman is not as productive an employee because of the fact that they are also running their family lives. And so there's the documented impacts, and then there's the career impacts that people don't talk about as much. And it's
Mhm.
simply like, oh, we are limited in terms of what we are being able to be offered. And we see this even like you and I both work in the development world. I find sometimes that people who have families or have children, they aren't offered the same like travel opportunities or the same research opportunities that folks that don't have children are
Mhm.
because of the fact that there's this assumption that they won't want to do it or it'll take them away. And so whether or
Mhm.
not people have those personal preferences is for an employer to determine. But I do really think there's a difference in how people are treated. And I'm also feeling or starting to notice that for myself. For years and years and years, I was child free. And
Mhm.
so now how that has shifted in terms of what I'm able to do and how people are talking about my future at my own organization. The best part is that my organization is a nonprofit, which
Mhm.
is focused on women and girls, and our maternity leave policy is 6 weeks, bare minimum,
That
bare
is like
minimum.
so typical too. I think, and part of it is because it's the nature of like working for a nonprofit where they don't have endless funds to invest in their staff. But if you are an organization that focuses its entire mission on supporting women and girls, the first internal staff policy you should have is a reasonable mat leave policy or family
No,
leave policy.
you would think so, right? And then you asked about it, and they're like, "Well, you can take your PTO and your family leave." And I'm like, "That's
That's
not
my PT, that's
like
my
why should I have to
PTO.
do that? Yeah, why should I have to do that?"
Pushing a baby out of my vagina is not a vacation, so I will not be using PTO. Or my favorite thing is that you can go on short-term disability because
Yeah,
they define pregnancy and childbirth as a disability,
yeah,
which is so
and
stigmatizing. I mean, give me a break.
yeah, my husband works in the corporate world and he gets 2 weeks paternity leave, which I think is pathetic, but
Mhm.
that's like so much better than industry average.
That he
And
even gets paternity
yeah,
leave?
that he gets
Yeah.
2 weeks.
Yeah.
And I'm just like,
Wow,
okay,
wow, we wow.
I know. And their company is run by women. So
Oh, well.
yeah, like their entire leadership is women. And
Interesting how women will even throw men a bone here. So if it's industry standard to not give any paternity leave and the company that's run by women is giving paternity leave.
yeah, I don't know enough about his industry compared to mine, but to me, like 2 weeks partner leave seems extremely low. But then you
Mhm.
compare that to like my women and girls nonprofit, which is 6 weeks for the birthing person. And it's like, okay, well, maybe this is actually better than
Yeah.
what you would expect
I think
otherwise.
2 weeks for paternity leave. I think, unfortunately, and paternity leave in general is a rarity.
Actually, I'm curious what that's like. So, Sweden's government implemented a paternity leave policy,
Hmm.
and it's either 6 months or a year. You'd think I'd know this stuff while talking about it on a podcast. But anyway, the point is that they implemented a national mandate for paternity leave, right?
Whoa, whoa,
And
whoa, whoa,
then
whoa. Mandated pat
man,
leave?
yes, mandated paternity leave. And they
Woo-wee!
meaning like they mandated that employers have to offer it.
Right.
And that distinction is important. So remember that. They
Okay.
mandated that employers have to offer it.
Yeah.
And then they realized that men were not taking it. So
Oh.
they did this qualitative research study across a bunch of industries and employers and interviewed the people in workplaces to try and figure out why men were not availing of their paternity leave.
Hmm.
And turns out the reason is because even in a place like Sweden, our internalized misogyny is so intense that men thought that by them taking the paternity leave that they are now legally offered, they would be perceived as weak, just like women are, and they would be denied career opportunities, just like their women colleagues are, because they were now taking paternity leave. So then the Swedish government was like, fuck this.
Hmm.
They mandated that now people have to take it. So it's not just offering it. And I just feel like that is such, first of all, a cool case study that shows how even if you change a policy, but you're not like trying to change the cultural norms of a place, the policy might not make a difference.
Hmm.
And secondly, how instead of backing down, being like, oh shit, we clearly misread the situation, mandated that
They
men
doubled
stop
down
being,
on it
yeah, they
instead of
literally
backing down.
mandated that men stop being so misogynistic towards themselves. I was like, this is amazing. They policied their way out of the patriarchy, which I think is kind of incredible.
It also shows that men do understand gender inequality and gender discrimination. You would think
Right?
otherwise in our comments when they say things like the gender wage gap isn't real. But then when they react like that and they're like, I don't want to take my own paid paternity leave because I may lose out on future opportunities like women, you're like, oh, you do see that this happens.
Yeah. Or like when you tell them about the stories where a study will like blind resumes to
Hmm.
remove like, the obvious gender bias and how like the women will get offered the jobs at a higher rate than men because their
Hmm.
resumes are blinded. And then all of a sudden the men are like, no, no, no. This is like, so that's, yeah, they get it. Of course they get it. It's the same reason why the transphobia movement in the US is so intense because they think that by being around, and I'm not justifying this in any way, I'm just saying like the unfortunate truth that we experience from the MAGA conservative crowd is the reason why they are so scared of the existence of gay folks and trans folks is because they think that they are about to be treated the way that they treat women.
Hmm.
And like they don't put that together in their head as the direct connection. But whenever they start talking, you can tell that the reason why they're so scared is because they think that they are about to be subjected to the same like degradation of your human rights and personhood or whatever it
Yeah.
is by those groups the way that they are with women. And I'm like, oh, this is the irony of this is truly incredible, but also lost on you completely.
Yeah, like it just comes down to you hating women. It also comes down to this idea that they all seem to think there's a finite amount of power or a
Yes.
finite amount of rights in the world. There is a pie of rights. And if you let women take some of those rights, there's less rights for men. Or if you let trans people take some of those rights, or just LGBTQA plus people of that community take the rights, that it's less for the white Christian straight men. Where does this concept come from of a finite amount of rights in this world? Everybody can have rights, and it doesn't take away from the white men's rights.
I don't know where it comes from. I can't pretend to know either. But what you're saying, like, it makes me think of that. I hope people are going to recognize what I'm talking about. There was this clip that went viral a few years ago of how those street interview folks, they sometimes go to like MAGA rallies and interview people. I think it was during Trump's first campaign. So it was sometime between 2014 and 2016. But there was this clip that went viral of this guy that was interviewing people at a rally about why they were super opposed to gay marriage.
Hmm.
And they were like, well, it's not fair because they want to have that right. And he was making the point that it is already a right that exists for straight people. So why shouldn't it exist for other people? Because it's not like they want more, they just
Hmm.
want the same. These people who were anti-gay marriage literally could not comprehend what he was saying. They were like, what do you mean? They're like, they want more. And he's like, no, they want the same. And they were basically just like, well, why do they want that? And he's like, well, why should you get to marry who you want? And they were like, because the thing that I'm doing is not against the Bible, whatever bullshit. They always bring in the Christian
It's always
nationalism.
the Bible.
It was like the most simplistic. He's like, they're asking for the thing that you already have, and giving them that is not going to take it away from you. It's just going to add to their lives. And they were like, impossible. How dare you suggest such a thing?
They just decide that it's a threat to them because it's fear of the unknown and being afraid of things that you can't relate to and don't understand, which is really simplifying it. But I don't know why else you would be so terrified to let other people live their lives in ways that do not affect you.
Yeah, and imagine that like the people representing this anti-gay marriage movement right now are like Trump and Elon Musk, two men who've had children by multiple women, have cheated on several of their ex-wives, and are now talking about the sanctity of marriage because they don't think gay people should be married. So there's no justification for anything that they think. It's pure selfishness. And that applies very much also in like pregnancy protections and the things we're talking about in this episode.
Yeah. And so taking Trump as the example, this psychopath who has had multiple marriages, multiple children, destroying the sanctity of marriage, also having an endless supply of funds to raise these children with private childcare. How could he ever relate to the struggles that women and families go through in trying to afford the cost of childcare for an unplanned pregnancy, right?
Yeah.
So I want to go through a little exercise to help people understand what this looks like, right? And also how it's connected to access to abortion care, access to contraception. There was a study I was reading about some time ago that said that when women have the ability to delay or space out their pregnancies, their earnings increase by 11% per year of education that they have. So think about that over the lifetime of a woman who's able to delay her pregnancy by 5 years, by 10 years, if it goes up 10% every year.
Yeah, and especially if that delay is to get a degree. Yeah.
And so her ability to access birth control, her ability to access abortion directly impacts her lifetime earnings and her career planning. On the flip side, when this access is restricted, women are disproportionately pushed out of the workforce and into lower paying jobs. So imagine that you are a young woman in her 20s. You're working to put yourself through school. You're juggling like a retail job to get by. If you become pregnant and don't have access to abortion care, the financial and time demands of parenting could force you to drop out of work for good. Even if you desperately need that job in order to afford childcare, that's not a personal loss. That's a loss for the larger workforce. And it puts women in an impossible position because the cost of childcare in the US is so high.
Okay, so I actually looked this up. The average cost of childcare across the US, of course, there's a huge range, right? Because like California versus Georgia, big cost of living difference. But the average cost of childcare annually in 2023 was $11,592. And that's per child.
Per year?
Per year, per child. So that's like if you're having obviously more than one, it's double that. And again, like I said, huge range, because when I was looking this up, I was seeing like, for example, in Seattle and Washington, childcare can cost up to $4,000 just in 1 month. So obviously, if you're saying that the average for the country is 11,000, for some states, that's like less than 3 months worth of childcare. So you have to be earning either way more than $60,000 a year to be able to afford that childcare and make it worthwhile, or you are just breaking even, or you are doing something that is a non-traditional work environment, meaning like you're working multiple jobs to try and make ends meet. And that doesn't even account for the fact that several of these states have a huge wage gap.
Mhm.
right?
It also doesn't account for the fact that the majority of women who have unintended pregnancies and are denied abortions, maybe because they've waited too long, they're 4 times as likely to live below the federal poverty line. So they're giving birth into a circumstance where they're already financially unstable, already are not making enough to be able to provide the average cost of childcare in the US. And add to that their medical bills, lost income from time at the hospital. The economic ripple effect of all of this is just honestly staggering. It
It really
overwhelms
is.
me. Yeah.
I'm curious, like we should look this up and talk about it in the future if there is one, but I'm curious if there's any data that suggests just how much money and opportunity the average woman misses out on per pregnancy. But what you were just saying got me thinking about how, this is my first pregnancy.
Hmm.
And over the last 8 months, if you are trying to be a responsible parent, there's like a cycle of prenatal care that you have to follow, right? There's like a certain number of appointments and a certain number of visits. And when you get into the third trimester, where I am right now, for example, in the last 4 weeks, they want to see you every week.
Right.
And before that, it was every 2 weeks. And then it's not just your one on ones with your OB, but then they also have ultrasounds, which are separate appointments and
Mhm.
things like that. So you have to be with an employer where either one, you have the type of job that is like flexible enough that allows you to take these big breaks during the daytime because obviously your doctor is also working business hours,
Hmm.
right? So you have to be able to go to all these appointments, or you're just not able to access that healthcare because you'd be at risk of losing your job.
So I have a question for you.
Yeah.
Let's assume that your employer is not listening to this podcast. Let's just hope and assume. If you're Pari's boss, time to tune out. How many hours do you think you've taken off work for your appointments related to your pregnancy?
I think honestly, I could actually probably get really specific with that if I
Mhm.
went through and looked to my calendar. But since we don't have the time to do that, let's say like, trimester one, where I am, they don't see you until 8 weeks. So like they saw me at 8 and then they see you once a month after that. So let's say like that's 3 hours right there. And then when you get into your second trimester, it is a little more frequent. It's every 3 weeks instead of four. So that's one, two, three, four, another 4 appointments. Let's see, we're up to seven. And then in your third trimester, it's every 2 weeks until your last month, where it's every week.
Damn.
So 7, 8, 9, 10, 11, 12, 13, 14. So I would say 14, right? 14 appointments. And granted, it's possible that I had some high risk stuff going on. So even if it's slightly less than that,
Hmm.
the hospital that I go to is only 15 minutes away from me. But
Hmm.
that's not the case for everybody. Like, that's
Yeah.
a luxury, right? Some
Yeah.
people live like super far away from their hospital.
You're not including commute time. You're not including waiting in the lobby for the appointment, all these things. I mean, it's literally multiple days of work when you
Yeah.
add it all up.
And I have heart palpitations, so I had to see a cardiologist that was separate from that, which I haven't even counted in this whole thing. But my point is that even if you were doing your absolute basic minimum required appointments, you are needing to take at least 2 full days off work over the course of your pregnancy, right?
Hmm.
Assuming you have a supportive employer, assuming you have the capacity to do that at all,
Hmm.
assuming you have transportation to get back and forth, all of this stuff. So there's economic consequences even along the way during
Hmm.
pregnancy that are hitting you before you even reach the point of childbirth. With childbirth, it's unpredictable. You don't know if you're going in for 24 hours or you're going in for 4 days,
Hmm.
and you don't know what the health of you or the baby are going to be like post delivery. So there's like so much at stake and so much that can change and have financial or economic consequences as a result of this whole process.
Hmm. Yeah. I think we should talk about what we can do to address this. And I can't say that we can do this as individuals, but the things that need to happen. First, comprehensive insurance coverage, right?
That would be amazing.
So,
Imagine
like,
if we could do
first
that.
of all, we should all have health insurance. That
Yes.
means health insurance that covers contraception, that covers abortion, that covers fertility treatments, like whatever you need to prevent or create the family of your dreams. And that's not an ethical thing, that is a strategic thing.
I mean, I
Um,
think like I just don't think that Americans think enough about how crazy it is that when you walk into a hospital or an emergency room, forget even pregnancy, just walk in at all.
yeah.
You have no idea how much that experience is about to cost you.
And they can't tell you
Yeah,
yourself.
like isn't like that's crazy. Like that's gaslighting
Yeah.
101, you know?
And
It's
other
just
countries look at us and are like, why, what is medical bankruptcy and why is it so common in the US?
I know.
Crazy.
Why are people totally fine with the CEOs of health insurance companies being gunned down on the street? Like, what kind of situation leads itself to that conclusion?
Okay, so first thing, comprehensive
Insurance.
health insurance. Step
Yeah.
one. Step two, normalizing paid family leave
Yeah.
for all genders. Going back to the example you gave in Sweden
Hmm.
about men having the option to take it and not taking it because paternity leave was stereotyped. But like overall, when both parents are supported, the responsibility of caregiving doesn't automatically fall on the woman, and this prevents women from being penalized for taking time off, which was the men's exact fear in that study you talked about. And
Hmm.
then the last piece, which is kind of like a softer exercise, I guess, would be employers creating inclusive cultures where reproductive health isn't a taboo thing, offering workshops, HR support, policies that acknowledge the unique things that employees might face in creating the families that they want. How transformative that would be if you could just be like, hey, I need time off for my health. And they're like, cool, go take it.
Yeah. I would also add, I mean, this is less a workplace policy and more of a federal policy, but the right to an abortion.
Yeah.
Yeah.
Because economists and advocates argue that abortion access isn't just a personal right, it's literally a public good. Because when you let women decide what they want to do with their bodies, they are more productive in the workforce.
Yeah.
Either
And
way, either
yeah,
way,
and in communities.
and in communities.
I mean, it is kind of wild where we have reached a point where, in some cases, right? I say some, that some employers in the US are actually changing their policies to systematically uphold reproductive rights for their employees because the government is not able to do it anymore because
Yeah,
we've
that is
reached a
wild.
point where,
Well,
yeah,
it's because they're recognizing that the US economy is literally losing like billions of dollars
yeah,
annually to productivity when women are unhealthy because they can't get the care they need or they can't return to the workforce because they're unhealthy. Like we live in a capitalist society and we're losing billions of dollars because we don't take care of women. Thanks for learning with us today about the intersection of workplace equity and reproductive rights. Next time, we'll explore what's ahead in health under an RFK Jr. led Department of Health and Human Services and a Republican majority in Congress. Until then, let's keep the conversation alive and the momentum strong.